Hello and welcome to this video. My name's Chris, I'm an Australian GP, and in today's hopefully pretty quick video, I'm going to be talking to you about one of the most common ailments that I see in general practice and one that I suffer with on a daily basis, eczema or atopic dermatitis or atopic dermatitis depending on your pronunciation. So let's just dive into it. What is eczema? Eczema is a chronic condition that affects the skin of course being absolutely everywhere, so it can affect absolutely anywhere, and it often causes a redness, a scaliness and an itchiness to the skin that can be really annoying. There are a couple of different types of eczema and I'll touch on them a little bit here, but I'm going to be talking very broadly today. Eczema itself is actually linked to a couple of other conditions known as the atopic family or atopic family, however you want to pronounce it. So eczema is actually related to asthma and hay fever. It's got to do with the histamines and all sorts of science behind it, but that's not the point of today's video. It's more just an overview. We don't know exactly what causes eczema, but we do know that it's a bit of an interplay between one's genetics and their environment. So if you've got a family history, you're more likely to get it. And if you're exposed to things that you are sensitive to or allergic to, you're more likely to have the skin reaction that is eczema because of that allergy or reaction. What we postulate is those with eczema have an overactive immune system, which responds to what would otherwise be considered mild irritants of the skin with quite a big reaction. Triggers for eczema vary from person to person and sometimes within the person from year to year, month to month, you name it. But common ones are having dry skin, chemicals or stronger irritants on the skin, so things like hand washes, detergents, soaps, etc. Perfumes, stress, animals, grass, there's a lot. So as I said, there's a couple of different types of eczema. The ones that I personally suffer with, I've got two. One is just general eczema, which usually occurs in the front of my arms. You can kind of see top of my eyes, which frustratingly is not linked to makeup because it's the first time I've worn makeup in over a week. My eyes are still irritated, it's just the way I am. But also on my fingers, and this is a different type of eczema. This is called dyshydrotic or sweat-related eczema, and it presents very differently. So for this one and this one, usually the skin starts a little bit red, gets quite itchy, and then can start to flake and crack and be quite annoying and irritating and painful. As for the stuff on my hands, dyshydrotic eczema, this is very common on the palms and soles, fingers and toes. And it usually starts as a rough patch of skin that then tends to bubble into little vesicles, which almost looks viral, like a herpes type thing, but it's not. And then those bubbles tend to blister and burst because I tend to scratch them because they are extremely itchy. The stuff that comes out is quite watery and serous. Basically it's not blood, it's quite thin liquid, and then it crosses over and can look like normal eczema again. So I do have a tiny bit, but you won't be able to see it on camera. A very common type of eczema is contact eczema or contact dermatitis. So it's very commonly on the hands, but not the description that I just gave of dyshydrotic or sweat-related eczema, but more, if you wore a band and you were allergic to it, then you would get irritation in that area. If you washed your hands or used bleach or detergent or soap, it'd be where it was contacted. If you're wearing a bra that had been washed in something new that you're allergic to, it would be just across there. As for how we figure out if you've got eczema or not, usually it comes down to history and just looking at your skin. Eczema is a clinical diagnosis, that is, there's no test needed to make the diagnosis. But sometimes we can do allergy testing and do a full blood count to see if your eosinophils, which are the cells, or the white blood cells I should say, responsible for reacting to allergies, if they're elevated or not. So how do we treat eczema? It's really annoying, and I can say that from personal experience as well as professional experience. It really depends on you, the location of it, what your triggers are, your age, and a whole host of things. So if you've got really mild eczema, like in my case, sometimes avoiding the trigger, if you can, and moisturizing it can be all you need. Given that dry skin is one of the biggest triggers as well, avoiding dry skin, so moisturizing again, but also avoiding hot baths and hot showers because that's quite dehydrating for the skin, even if you're in the water. Often in a flare or moderate to severe eczema, a topical corticosteroid is used. So this is something like Dermade or hydrocortisone, mometasone, can be a lot of things. This is because steroids reduce the immune response and stop the irritation of that area. And we want it to be topical only on the irritated area. That's to not affect the whole body, because steroids can have long-term effects. And there is such thing as using too many steroids or too much steroid on eczema as well. So this should be judicious and used only in a flare, only as directed by your practitioner. There are also non-steroidal creams. The only one I can think of is Elidel, which is pimecrolimus. I don't know if I'm pronouncing that right. I've never heard it said. I've only ever written it down and read it, which can also modulate the immune response. In severe or widespread eczema, sometimes we just want to reset the skin barrier and do something called bleach bathing, which is exactly what it sounds like, bathing you in bleach. Not pure bleach, obviously, it's really well diluted into a bath, but doing that, sometimes oat baths can be useful as well, but bleach baths are more, I guess, the medicated version of that. And then really well emoliating, moisturizing, and doing something called wet wrapping, which again is exactly as it sounds. Wrapping the skin in a wet bandage, topped by a dry one, sometimes even overnight, to keep the integrity of the skin barrier and stop it from drying out and allowing it to heal. Sometimes we use oral antihistamines to stop the itch, and sometimes we use oral steroids because you just can't avoid it. If you are having such bad eczema that you're flaring a lot, or everything I've said hasn't worked, have a chat to your doctor about whether it's time for a referral or not. Sometimes eczema is just really severe, and sometimes we need to start looking at the root causes more. So is it an allergy? Do we need to put you on immunotherapy to reduce your immune response to that allergen or irritant? Because it's not actually going to hurt you, it's just your immune system working too hard. Again, there's a lot of things we can do, and we really have to tailor our treatment to your specific needs. So this is in no way me telling you, you've got eczema, this is how you treat it. It's just giving you information. And that's it, guys. Eczema 101. I hope you enjoyed and learned something. If you have any questions, let me know. Of course, I can't answer anything personal, but in general, education sense, I certainly can. If you have any requests for videos, let me know. Until next time, do stay safe, stay healthy, and I'll see you in a video very soon.